Palliative care is a service that provides care for patients with a life-limiting illness. Palliative care aims to provide the support so that patients with these type of cancers can live as well as they can.
Palliative care does frighten people because of its traditional association with the dying phase of illness, but it's really important to get the message out there that palliative care equally is for people with any degree of symptom that needs addressing, or any degree of psychosocial or psychological or emotional dimension that needs to be addressed by those of us that are caring for them. And the earlier the referral comes to palliative care, the better it usually is for patients and their families. And I have to say, it's my experience and that of all of us who work in palliative care that it's often an enormous relief for people to be referred to the palliative care service, whatever misgivings they might have, to discover that it doesn't mean that they're about to die next week, and that we can do a whole lot to make things a lot better for them, hopefully for many months before the illness starts to take more of a toll and we start thinking about time being limited.
Patients are usually referred to a palliative care service by their general practitioner, but mostly by their specialists, whether that be their neurosurgeon, whether that is their radiation oncologist or medical oncologist. They are the people who recognize when it is time for their patients and families to be referred to palliative care, when they see that headaches are not so easy to control, or their mobility is not so steady, or they can see that families are becoming distressed by what is going on with their family member.
There's often some debate about where it's appropriate to involve palliative care in the trajectory of any person's illness, and the answer from us in palliative care is that we should be involved in any life-threatening illness whenever the patient has symptoms, whether they be physical or psychological, that require expert advice.
I alone as a doctor can help with the headache, can help with the nausea, but I also therefore have a team of doctors, of nurses, physiotherapists, occupational therapists, social workers, volunteers, psychologists who help patients and the family deal with the multitude of things that patients and their families come up with.
The most important and sometimes one of the most complex symptoms is pain. Not everybody who experiences cancer will get pain, even though it's a widely held belief that cancer equals pain.
Someone who's having surgery will have pain from their surgery, and palliative care will provide the support and the pain relief while they're going through their surgery. Radiotherapy will cause tiredness. Palliative care will provide assistance, support, equipment, so that the patient will be able to minimize the efforts when they're very tired. So palliative care goes hand in hand with a lot of treatments, whether it be in hospital, whether it be in an inpatient unit, whether it be at home. Palliative care follows the patient and supports them wherever they are. Palliative care helps quality of life by improving it, by positively improving the history or the trajectory of the illness itself. When I say positively, it means that we improve the patient's symptoms, the patient's pain, the nausea, the headache, the constipation, the tiredness. If we are able to improve those symptoms, then patients will be able to actually do more with their life. If you think about it, someone with headache all the time can't concentrate on anything else or think about anything else other than the headache. If I'm able to control the headache with medications, then the patient can then actually think about other things that that patient needs to think about, the future, about their family, about their finances, about the spiritual issues that he or she will need to deal with. So by controlling those symptoms, by providing that support, I can actually positively influence the way that patients deal with the disease, live with the disease, or even get the disease treated as well. Once we get to know patients, once we get to know how we look after their issues, their problems, pain, headaches, nausea, constipation, their reaction changes. As a patient has said to me, their focus became one of constant pain and inward looking. And when their symptoms became well controlled, they suddenly became outward looking and then seeing a future for themselves. The main message, I think, is palliative care is about living. Living as well as one can, and families enjoying that period of life, that important period of life, because that's where a lot of memories are going to be created. Living as well as one can before that patient passes on. That's the main message that palliative care is about now.